breaking the news time, I'm Janice Shortle. The Minnesota-based Hazelden Betty Ford announced a big expansion today, but the addiction treatment provider isn't adding any new locations. Instead, it's expanding what patients are treated for. Kent's here to explain why care for substance use and mental health are finally going to go hand in hand.
For more than 75 years, Hazelden Betty Ford's mission has remained constant.
Helping people with their substance use and giving them the tools to live their life beyond our walls.
But Ranenarch says how they help
Depression and trauma
is set to expand in a big way.
We're here with new tools for you when life breaks down.
Hazelden Betty Ford is now integrating mental health treatment into every one of its substance use programs.
It's just really redefining the way that we're doing care here. It was a necessity, in my opinion. I think it took us a lot of courage, though, to say our care needed to evolve with our patients.
He says 79% of patients now have more than one treatable mental health condition, a 10% increase in just 5 years.
The pandemic impacted our patients in pretty profound ways. Most of our patients have 2 to 3, if not more, mental health conditions that they're going through.
He says more than half of all patients have some kind of anxiety disorder, 40% are dealing with depression, and 38% are battling trauma or another stress-related disorder.
That's often what's returning them back to substance use. And so if we don't start addressing their mental health in a more comprehensive way, our patients are at risk for undue outcomes that we don't want them to have to go through.
So were you realizing that you were, in some cases, treating the symptom and not really the problem?
To a certain extent, I think. It's really a holistic approach to care. What this effort is trying to get more at the root, help them live a healthier life.
And the new approach will begin the minute patients enroll.
What we've now created is new pathways, essentially. So once we've gone through the screening with folks, we now have ways to better place them into programming that is more specific to their needs and with how we can better treat them.
So if someone comes in and they need help for a certain type of substance use, but also are dealing with anxiety and trauma,
correct,
there's a pathway that's a little more tailored to their needs.
100%. Thinking about the way that we do group therapy, our individual therapy, psychiatric support, our nutrition, our wellness, our spiritual care, it impacts all of these areas.
This sounds like a pretty big deal.
It's probably our most ambitious change we've made in our 76-year career.
And it's all intended to bring everyone one step closer to that continuing mission.
These are treatable conditions. We have a lot of innovative ways to give people the tools and the hope that they're looking for.
Now, this effort to treat both addiction and mental health is being rolled out as the new standard of care at all 15 Hazelden Betty Ford sites across the country this month, and for every type of treatment, from inpatient to those enrolled online. It's something, Jana, that isn't necessarily a new concept,
Sure,
but in the addiction space, it's something that just hasn't really been the standard. It's been so much more segmented based on the individual or different sites.
and finally just being proactive, like this has been overlapping forever, let's change it.
Yeah, exactly, especially as they've seen that need grow since the pandemic.
Yeah, thanks so much, Kent. Important story.